Finding a lump in your breast, especially when you're breastfeeding, can be absolutely terrifying. But you know what? Knowledge is power. So in this guide, we are going to break down exactly what a breast abscess is, how it develops, and the clear step-by-step path you can take to manage it.
So let's start with the question that's probably front and center in your mind right now. What is this painful lump? Answering this is the very first step toward feeling better and, more importantly, taking control of the situation.
Here's our roadmap. We're going to define what a breast abscess is, trace it back to its origin, which is usually mastitis, and then walk through its crucial 4-phase evolution so you know exactly what to look for. We'll also cover diagnosis, treatment, and of course, prevention.
First things first, let's get right to the facts. Understanding exactly what we're dealing with is honestly the best way to quiet that fear.
Okay, so in simple terms, a breast abscess is basically a walled-off pocket of pus that forms inside the breast tissue. It's usually caused by a bacterial infection that hasn't cleared up. The key words here are collection of pus and infection, which tells us it's a localized problem that needs specific attention. So how does this even happen? Well, an abscess doesn't just appear out of nowhere. It's usually the final stage of another very common breastfeeding issue, mastitis. Let's look at how that inflammation can escalate.
The main culprit is a case of mastitis, or inflammation of the breast, that just doesn't get better. This can happen when a milk duct gets clogged up, or when bacteria, most commonly Staphylococcus aureus, sneak in through tiny cracks in the nipple. And while it can happen to anyone, certain things like smoking, diabetes, or a weakened immune system can increase the risk.
And this brings us to the heart of our guide. A breast abscess develops in a pretty predictable way, which we can break down into 4 distinct phases. Understanding this journey is your best tool for knowing when and how to act.
It all starts here, in phase 1. You'll feel a firm lump. It might be a little sore, but the key things to notice are that it doesn't shrink after nursing and you don't have a fever or any redness on the skin, yet. At this point, the game plan is to keep breastfeeding, use cold packs for the swelling, and just keep a close eye on it.
Phase 2 is the turning point. The lump might actually feel softer, but the pain gets worse, and the skin can look red and shiny. But the most critical signal of all is a fever. The second a fever shows up, it's time to see a doctor, immediately. This is when antibiotics become essential to stop the infection in its tracks.
Now, phase 3 is a weird one, and this is where it gets a bit counterintuitive. The lump is now very obvious, and when you touch it, it feels like it has liquid moving inside. It fluctuates. The skin is very red and shiny, but here's the crazy part. The pain is gone. This doesn't mean it's better. It means the abscess is mature and ready to be drained.
Finally, phase 4, recovery. After it's drained, your experience depends on the method. With a needle, recovery is super fast. With an incision, you might have a small drain for a few days and even see some milk leaking from the wound, which is totally normal. The most crucial point, and I cannot stress this enough, is to keep breastfeeding from that breast. It is vital for healing because it keeps the milk flowing and helps prevent it from happening again.
Going to the doctor can be stressful, so let's demystify the process. Knowing what to expect when you get there can really help lower the anxiety.
Your doctor will likely follow a 3-step process. First, a physical exam. Second, an ultrasound, which is the best way to see the size and location of the abscess. And finally, they might take a sample for a culture. This is a great example of precision medicine because it helps identify the exact bacteria so they can prescribe the most effective antibiotic. All right, let's move on to the treatment phase and see how this gets us on the road to healing. This is the active part of the journey where you and your doctor work to resolve the infection for good. There are 2 main ways to drain an abscess. The most common is needle aspiration, where a doctor uses an ultrasound to guide a needle and draw out the pus. It's minimally invasive. For larger abscesses, say over 5 centimeters, or if there are multiple pockets, a small surgical incision might be needed. This sometimes involves leaving a tiny flexible drain in for a few days to make sure everything gets out. After the procedure, your care at home is vital. Take your pain relievers, use warm compresses, and of course, finish the entire course of antibiotics. And yes, I'm gonna say it again because it's just that important. Keep breastfeeding. It is one of the best things you can do to help your body heal and ensure the ducts stay clear. Now that you know how to get through it, let's talk about the best part, making sure this doesn't happen again. Let's focus on prevention. Prevention really comes down to good breastfeeding management. Make sure your baby has a deep, effective latch. Always try to empty one breast completely before switching to the other. Keep your breasts clean and dry. And most importantly, if you feel those first signs of mastitis, like a hard spot or redness, get help right away. Early treatment is the best prevention.
And there you have it. We've turned a scary, unknown lump into a clear, 4-phase journey. This information isn't meant to frighten you, it's meant to empower you. You now have a toolkit to take control of your health. The only question left is, are you ready to use it?